Hi, in this video I'm going to be talking about how you decide what type of breast surgery to have if you've been diagnosed with breast cancer. There are several options for surgery in breast cancer regardless of the stage of the disease. If you want to learn more about your possible treatment options, visit Yerbba.com for your personalized report. So the purpose of surgery is to remove the primary tumor and to remove any involved lymph nodes or glands in the armpit or axilla. That's called an axillary lymph node dissection or a sentinel lymph node assessment. It depends on how many lymph nodes are going to be removed. That information will tell us the stage of the cancer along with the tumor size. So the types of surgery that you can have include a mastectomy, which is removal of all of the breast tissue, and usually the lymph nodes will be assessed. One exception would be ductal carcinoma in situ, or stage 0. We'll drop a link to our video about DCIS. And in that case, we generally don't remove the lymph nodes unless we're worried that there might be some invasive cancer within that tumor. In invasive cancer, stages 1, 2, and 3, in which the purpose of treatment is cure, the purpose is to remove the tumor and then decide whether or not additional treatments like chemotherapy, radiation therapy, and hormonal therapy would be part of that person's treatment options. A mastectomy can be followed by reconstruction. And there are two types of reconstruction, actually probably three types of reconstruction. One is an implant, another is having your own tissue moved, and then some people actually have a little bit of a combination of both, depending on the appearance of the breast and whether we're trying to make it symmetric with the other breast or not. People who choose to have reconstruction have a little bit longer a recovery time, but it's not required to have reconstruction. Lots of people choose not to have reconstruction, and it's perfectly acceptable. You may get pressure to have reconstruction, but it's your decision, it's your body. The other option is breast conserving surgery. You may hear this called a lumpectomy, you may hear this called a wedge resection, you may hear it called a wide local excision. That's generally more for diagnostic procedures, but there are lots of different things we call this, partial mastectomy, but the umbrella term for this is breast conserving surgery, and the purpose is to allow you to keep most of your breast, again, removing the tumor. In general, the outcomes are equivalent, whether or not you have breast conserving surgery or a mastectomy, as long as a breast conserving surgery is possible. So there are some tumor characteristics that would be associated with breast conserving surgery not being possible. So if your breasts are very small and the tumor is very large, a mastectomy with or without reconstruction is your best bet. What's a large breast? What's a large tumor? It's really the relative proportion, so I can't tell you exactly, but a lot of small-breasted women who have, for example, non-invasive breast cancer can get a better cosmetic outcome. They're happier with the way the breasts look if they have a mastectomy with reconstruction. Some people after breast conserving surgery also have oncoplastic surgery, and that's where there's some tissue removed from other parts of the body to fill in the defect or the space left by the surgery, and this can give you a better contour to the breast. So this is an option, especially if you have a surgeon or have a surgeon who works with somebody who's done additional training in oncoplastics. I'm not going to talk a lot more about that, but we do have other videos about that. The other characteristics that would make a mastectomy a better option are if there are multiple tumors throughout the breast. So if there are two tumors in one quadrant, imagine taking your breast as a circle and dividing it into 4 quadrants. 2 tumors in one quadrant usually doesn't mean you have to have a mastectomy. But if you have tumors in more than one different quadrants or in multiple quadrants, a mastectomy is probably the best option for local control of the tumor, not the spread throughout the body, but keeping the tumor from coming back in the breast. I'm going to talk a little bit about radiation because this may factor into whether or not you have breast conserving surgery or a mastectomy. Most people, or many people who have breast conserving surgery, are advised to have radiation after that. There are some exceptions. If you want to learn more about whether these might apply to you, you can visit Yerbba.com for your personalized report to learn more. But in general, most people who have breast conserving surgery will at least have a conversation about radiation therapy. For people with mastectomy, who have a mastectomy, it doesn't mean you won't need radiation therapy. How can that be? Well, if you have positive nodes or a tumor that's more than 5 centimeters, which is about 2.5 inches, or any one of a number of other features, you will be advised to have post-mastectomy radiation therapy. So it's not a case of, if I have a mastectomy, I definitely won't need radiation therapy. Radiation may be part of your treatment plan to give you the most control over the disease and reduce the risk of it coming back in the chest wall or elsewhere in the body or in the neighboring lymph nodes. If some have been removed, there are going to be some left, and those could be involved with cancer down the road. We've gotten quite a bit more knowledgeable about who benefits from radiation after mastectomy in general: younger age, bigger tumor, positive nodes. Those are the things that weigh in on whether or not we're going to be having a conversation with you. All of these are your choices. This is your body, but I'm just talking about what the guidelines say here. So if you have a choice of radiation therapy, and keeping the breast means you would have radiation therapy, you'll want to decide how that fits in with your lifestyle. We hate to think that travel means that you can't have breast conserving surgery, so we usually find ways to make this work. Radiation oncologists start very early in the morning and they go quite late in the day to work around your work hours, and transportation can be, you can get help with transportation from the radiation oncology practice who can connect you with community resources. We once had a hypothesis that people in the winter would be more, who lived in northern climates, would be more likely to have a mastectomy. And although one small study showed that, that's not the case, meaning that no matter the weather, if you need radiation therapy, you can make it work, and we're here to help you. I've covered a bunch of things: breast conserving surgery with radiation, some exceptions. We've talked about mastectomy and the need for radiation after mastectomy. I touched on reconstruction options. I hope this has been helpful to you. If it has, click like and subscribe. Share with anybody you think it might be helpful for. And as always, drop us a comment below. We'll get back to you as soon as possible, usually within a week to 10 days.